Hi, I want to apologize for this video being late, but I've tried to do this video and somehow or another I lost it. But it's something that I think that really needs to be touched on because it is manifesting fast. And it's HIV and AIDS awareness. And what I want to start with, I'm going to start with some of the symptoms of HIV. What are the symptoms of HIV? How long it takes HIV symptoms to appear differs from person to person. For some individuals, it may take several years or more before an HIV symptom presents itself. For others, symptoms may appear sooner than initial infection. Unfortunately, oftentimes a person living with symptoms will spread HIV to others unknowingly. The only way to know whether or not you have HIV is to take an HIV test. For people who participate in high risk activities such as having unprotected sex or sharing drug needles, for CDC recommends getting tested at least once a year or before beginning a new sexual relationship. How can I tell if someone has AIDS? There's no way to tell if someone has AIDS or HIV rather than getting tested together. Don't trust the person by saying they took it. Do it together. Anyone can be infected with HIV. In fact, the CDC estimates that approximately 250,000 Americans have HIV and not aware of it. A person's HIV status cannot be determined by their gender, age, race, sexual orientation, or nationality. What do HIV symptoms feel like? Early symptoms of HIV feel like and may even be mistaken for long-lasting flu. This flu-like symptoms may occur 4 to 8 weeks after infection and are known as HIV seroconversions or an acute HIV infection. Some of the symptoms that results from HIV includes swollen lymph nodes, fever, diarrhea, headache, muscle aches, nausea, vomiting, rash on the abdomen, arms, legs, and face, a sore throat, or oral thrush, which is a fungal infection found in the mouth. During the initial period of the infection, the body's immune system fights the HIV virus and as a result, rids itself of flu-like symptoms. A person's ability to spread HIV is the highest during the stage due to a high amount of virus in the blood. Effects of uncontrolled or untreated HIV. An uncontrolled or untreated HIV infection can lead to serious health complications, including AIDS, acquired immune deficiency syndrome, as the HIV virus progresses over the course of months or years. The body's immune system continues to deteriorate and weaken, ultimately leading to AIDS. Once the disease moves into the clinical stage, as also known as symptomatic or chronic HIV infection, HIV reproduces at a very low levels, but is still active. As an individual's viral load amount of HIV in the blood begins to rise and their CD4 plus white blood cell count begins to fall, they are vulnerable to a series of infections and illnesses. The advanced stage of HIV is known as AIDS. The immune system is compromised by at this point, and is unable to protect the body from HIV-related symptoms or new infections or illnesses. These symptoms include swollen lymph node glands, fatigue, repeated fevers at night sweats, diarrhea, headaches, body aches, sore throat, joint pain, weight loss, short-term memory loss, mouth sores and ulcers, gingivitis, gum disease. For women, yeast infection, mouth and vagina, and PID, pelvic inflammatory disease. Additional symptoms that result from an HIV weakness immune system includes repeated skin rashes or flaky skin, oil thrush, skin pox, fungal infections on the skin or nails, and oily coating crust and scales on the skin. And I do want to tell you that there are ways of protecting yourself to prevent you of getting HIV. First of all, I want to say, if you know that you have HIV, be honest, be an adult, and tell the other person before having any sexual contact with them that this is what you have, and let them make that choice. Because some people love people for their heart. Not worried about that. And y'all can take proper precautions so that it does not spread. Okay, starting with condoms. Because, and honestly, when we all took that first HIV test, we were all scared. Because there was a time HIV condoms didn't play a big part in our lives, especially in our younger days. And they also have an over-the-counter medication, which is called, let's see, is it oh my God, can't think of the name of it right now, but I'll get to it. If you love someone truly from the heart, refrain from penetration. If that's what it takes, that's what it takes. Okay? Also, one thing I want you to know is, if you're knowingly having HIV or AIDS, you are committing a felony. So if you sleep with someone and you know that you have it and you don't tell them, that's a felony. Just look at it like this. It's as simple as you shoot somebody with a gun and leave them in a vegetative stage to die slowly. That's basically what you have done. Okay, there is a medication, and it's called Descovy for PrEP. Is the newest protein to help prevent HIV. Descovy for PrEP, which is a pre-exposed prophylax. It's a once-daily prescription medicine to reduce the risk of getting HIV infection in adults and adolescents who weigh at least 77 pounds. It is not known if Descovy is effective in in reducing the risk of getting HIV. For one certain types of sex. Descovy for PrEP is not for the use of people assigned females at birth who are at risk of getting HIV infection from vaginal sex, because its effectiveness has been studied. Talk to your healthcare provider to determine your risk of getting HIV if Descovy for PrEP is right for you. Find a PrEP healthcare provider near you. Sign up for the updates after Descovy for PrEP has contacted you. Learn about financial assistance for Descovy for PrEP. Important safety information. What is the most information I should know about Descovy for PrEP before and after Descovy for PrEP? 1. You must be HIV negative before starting and while taking Descovy for PrEP. You must be tested for HIV immediately before, at least every 3 months while taking it. If you think you were exposed to HIV, tell your healthcare provider right away. They may want to do more tests to confirm that you are still negative. Many HIV tests can miss HIV infections in a person who has recently become infected. Tell your healthcare provider you have had a flu-like illness within the last month before starting or while taking the medication. Symptoms of new HIV-1 infection include tiredness, fever, joint or muscle aches, headaches, sore throat, vomiting, diarrhea, rash, night sweats, and enlarged lymph nodes in the neck and groin. Descovy by itself is not a complete treatment for HIV. Do not take Descovy for PrEP unless it has been confirmed to be HIV negative. Descovy does not prevent other sexually transmitted disease. Practice safer sex by using a latex or propylene condom to reduce the risk of getting STI. To further help reduce your risk of getting HIV, do not miss any doses. Missing doses may increase your risk of getting HIV. Know your HIV status and the HIV status of your partner. If your partner is living with HIV, your risk of getting HIV is lower if your partner constantly takes IV treatments every day. Get tested for other STIs. Some STIs make it easier for HIV-1 to affect you. Talk to your healthcare provider about all ways to help reduce HIV risk. Descovy can also cause serious side effects. Worsening of hepatitis B infection. Your healthcare provider will test you for HBV. If you have HBV and stop taking Descovy, your HBV may suddenly get worse. Do not stop taking Descovy without first talking to your healthcare provider, as they will need to check your health or give you HPV medicine. Who should not take the Descovy for PrEP? Do not take the medication if you already have HIV or if you do not know if you have HIV. If you have HIV, you need to take other medications with Descovy to treat HIV. If you have HIV and take on Descovy, your HIV may become harder to treat now and in the future. What is the other possible side effects of Descovy for PrEP? Kidney problems, including kidney failure, too much lactate acid in your blood, severe liver problems. Common side effects in people taking Discovery for PrEP are diarrhea, nausea, headache, fatigue, and stomach pain. Tell your healthcare provider if you have any side effects that bother you or do not go away. What should I tell my healthcare provider about taking Discovery? All your health problems, all your medicines you take. You are encouraged to report negative sides of prescription drugs to the FDA, which you can visit at www.fda.gov. MedWatch or call 1-800-FDA-1088. And again, my main issue is, if you know that you are positive, please be responsible, be mature, and tell your partner. Because you are playing Russian roulette with their life. And it's not right. I see no fun and game in it at all. Also, women, if you have HIV and you have not had a child, think about adoption or some other form, because that's how a lot of babies get it, through childbirth. And then definitely after the baby's born and the baby doesn't have it, for no reason should you breastfeed, because whatever you put in your body, you're putting it in your baby's body. So whatever you do, do not breastfeed a baby if you are HIV positive. Again, I will say, if you know you have the virus, please do not practice sex with other people without telling them, male or female. If you like this video, I ask that you hit like, subscribe, share, and please listen at what I said in this video. None of us are exempt. None of us. Thanks a lot for listening to my video. Feel free to refer back to it at any time. If you have any comments, please comment down below, and I will reply to your comment. And thanks a lot for listening. Have a nice day.